Hello, welcome to Cancer Smiles and Sarcasm. Today I have Abby with me. Hey, Abby,
Hi,
how are you doing?
I'm doing great. Thanks for having me.
Yeah, Abby is a fellow breast cancer patient. So, Abby, why don't you tell us what kind of cancer diagnosis do you have?
I was diagnosed with triple positive IDC, invasive ductal carcinoma breast cancer in late 2018. So actually 7.5 years ago that I was diagnosed. And so I'm still in treatment for that, just with hormone modulators, but not active treatment the way people think of it as, with chemotherapy or radiation. I already finished all of that.
So, what does that mean? Like, what does triple positive mean? What does that mean that you're still in treatment?
So there are certain markers with breast cancer that they test the initial tumor for, and that kind of it gives you a typing, and depending on the markers of your tumor, it determines what kind of treatment you'll receive. So I think there's a lot of misinformation about, oh, breast cancer is breast cancer. My aunt had breast cancer, and they're not at all the same. Triple positive means that your tumor is estrogen positive, progesterone positive, and HER2 positive, which is a protein. So, because I had the HER2 protein, that completely dictated the drugs that I was given. It's a particularly aggressive form. Because of that HER2 protein, it tends to come back most likely in the first 5 years if it's going to. And that's exactly what happened to me, even though I did do the standard of care. But it's also considered one of the more treatable breast cancers because it does have all three of the markers. So therefore you can kind of hit it by treating the estrogen, suppressing the estrogen, and you can also, hit it with killing the HER2 cells.
Okay. And so, what was the standard of care that you originally went through?
So they said I would need chemotherapy, which at that point was recommended a drug called Taxotere, which is one of the Taxol family of drugs. So Taxol is kind of a lighter dose that's done over 12 weeks. And then Taxotere, the one I was on, is a heavier synthetic form of it that's done every 3 weeks because it really knocks you out. I mean, your blood levels drop. So it takes 3 weeks to recover enough to do the next round. So the Taxotere, the regimen was called TCHP. T was Taxotere, and then C is carboplatin, which is one of the aluminum-based chemotherapies, so similar to cisplatin and a lot of those. And then the HP was Herceptin and Perjeta, which those are one of the HER2 targeted drugs. Those are considered kind of an immunotherapy, so they're not chemotherapy, but they're done along with the other two chemotherapy agents. They found it was most effective to do them in conjunction. There are some women or breast cancer patients out there who choose to not do chemotherapy and just do Herceptin or Herceptin and Perjeta, but I went with what they recommended, which was kind of the heavy hitter. And I did that for 6 rounds. And then I had surgery. And it was kind of up to me if I wanted to do a lumpectomy with radiation or a mastectomy. They recommended a lumpectomy, which is called a partial mastectomy, followed by radiation. They said it was shown to have kind of the same rates of recurrence and survival as a full mastectomy. So I did that. And then I did whole breast radiation, which is what they recommended. And then I had another that Herceptin drug, the H, they recommend for a full year, which is 17 rounds. So after I finished the surgery and radiation, I stayed on Herceptin for the rest of that year, which was 2019, although I had to stop after 15 rounds of 17 because I sustained heart damage from it. So one of the things about Herceptin, called trastuzumab, is that it attacks the HER2 cells in your body, and a lot of other parts of your body have HER2 cells, including your heart. So when you are a HER2 positive breast cancer patient and you're on a trastuzumab based drug, you do get echocardiograms every 3 months to monitor your ejection fraction and make sure your heart's doing okay. And mine was not. So I stopped a little early. And at that point, I had also started taking tamoxifen, which is called a SERM, a selective estrogen receptor modulator. And they had recommended that I be on that for 5 to 10 years. So as soon as I was done with radiation, I started tamoxifen. So that was that was my standard of care to do the chemo. therapy, then the surgery, then the radiation, and then the estrogen therapy.
Wow. So you've been through it. And that chemotherapy, that's because I'm on a chemo pill, right? So, but you are like in there, the chemotherapy that everyone thinks about, right? That you get the IV and it's dripping through your veins, correct?
Yeah, yep. You're in the infusion lab. It's always, yeah, it's injected, and it's actually I had a port put in as well. A couple weeks after my diagnosis, I had a port put in, and that's where they put the needle so that they can inject the chemotherapy agents and the Herceptin right into your heart because it's really harsh on the veins.
Yeah.
It's another thing people don't always realize about chemotherapy that can be pretty for some people, they don't mind it, but for me, it was pretty traumatic actually to have the port. It wasn't comfortable at all, but it does make the infusions easier.
Do you still have your port?
Nope, they took it out after I was finished with my Herceptin, and that at the end of 2019, they took it out.
Oh, okay. So, and then you had heart problems, or heart damage. What does that look like now, or what happened with that?
I've completely recovered from that, from what I understand. Chapter 2 of my story was that the following spring, I got my annual MRI, which they do recommend for people who are HER2 positive and on the younger end, like I was 42. And that MRI actually found tumors in that same breast. So I now had a recurrence. Either it was a recurrence or it was residual. No way to know really, but that was within 6 months of finishing my last trastuzumab. So it put me into kind of a poor prognosis category. So I actually then kind of restarted treatment. So what happened is at this point they had a new kind of chemotherapy for triple positive breast cancer or HER2 positive, which was called Kadcyla or TDM1, and that it's like a Trojan horse. It's like the chemotherapy is attached to the trastuzumab. So people consider it a less toxic chemotherapy because you don't lose your hair because it's like, it really targets the cancer cells and the HER2 cells.
Mhm.
So I got 3 or 4 second opinions because nobody really knew what to do with me or how long I should be on that drug. I got recommendations of 6 months, which would have only been, I don't know, divided by 3 every 3 weeks. It was more like, I don't know, 6 or 7 rounds, and then someone told me I should do 14 rounds, someone told me I should do 17 rounds.
Wow.
So I was really scared. I also was told I needed to get a mastectomy because now I had an even higher chance of recurrence because I had had one so quickly. So at that point, I got a mastectomy of that same left breast with reconstruction, which was a really complicated surgery that took 12 hours. And then basically a week later, I started that new chemotherapy and was on that for another 10 months. So that carried me right through till the summer of 2021. So I had kind of 3 years of active treatment because I was kind of an unlucky outlier, I guess, of having my cancer come back so soon or have not been eradicated totally. Nobody really knows what happened, but
Yeah. Wow.
so I was again at risk of heart damage because I was on another trastuzumab drug. So I then had to get echoes every 3 months again. I managed to make it through 14 rounds, and I have not had an echocardiogram since because that's one of the hard things about cancer treatment is like once you quote unquote finish, they kind of just cut you loose and you don't get tested anymore. I do a ton of cardiovascular exercise and I started doing saunas because I was reading a lot about how regular sauna use can help your heart recover. So I have been like, I've had excellent self-care for the last, 5, 6 years. And I would guess that if I had an echocardiogram now that my heart is right back to normal. I don't notice any changes.
Well, that's great.
Yeah.
So you do saunas, and then what other kind of self-care have you been doing throughout were you doing during those 3 years? How about that to start?
Well, I'm a researcher. So from the day I was diagnosed, I just did a total deep dive into breast cancer treatment. I researched all of my medications and how to help mitigate side effects. I started seeing a naturopath as well as kind of what more people consider kind of like woo woo. I went to a chiropractor who did muscle reflex testing where they put the supplements or medications on your body and then like push your arm I don't know if you've heard of this, to try to
Mm.
kind of see what your body's asking for, which again, it's very new age, but a lot of people swear by it. But during chemotherapy, I did cold capping to keep my hair, where you freeze your head.
Mhm. Did that
I
work?
It did work. I was
Nice.
the first person in my hospital to have done it. Nobody believed in me. My oncologist, everybody scoffed and nobody supported me. I had to pay all the money and cart the freezer in there with 50 pounds of dry ice,
Oh, wow.
but I kept probably at least, I would say, I don't know exactly, probably 75% of my hair, like to the point where I noticed it was thin, and I lost patches, but I looked like relatively normal. I lost every other hair on my body from my eyebrows down. So it clearly does work for a lot of people.
Wow, nice.
Yeah, and I started doing fasting because I'd been reading a lot of mouse trials that if you are in a fasting state when you receive chemotherapy, it makes it more effective and it also lessens kind of the harm to healthy cells. So I was the first with my I could call it like my first bout of cancer. I was really, really hardcore and dedicated. I was doing tons of supplements. I was doing everything.
Yeah.
The second time I didn't. I just lost steam and I was so discouraged and I just kind of gave up and was like, whatever, I just didn't have the energy for it. And my naturopath was really supportive about that. She's like, you are doing so much. During radiation, I did hyperbaric oxygen therapy. I would take bentonite clay after, all these things that are supposedly like binding agents for toxins. I did even during radiation, I made a salve, which I had talked to you about, which I used on my
Mhm.
skin with aloe vera gel and calendula oil, and that kept me from burning. I didn't have the bandwidth for everything all at once, but as I would enter each stage of treatment, I would do a ton of research and basically was doing most of it on my own because, the conventional medicine, they don't go too deep into all of those complementary care.
Yeah.
Yeah, so I'd say those first 3 years I was doing a lot of different things, and then now where I'm in kind of more of a post-cancer stage, I have more of just like a self-care, regimen.
Okay. And
Um,
how long have you been post-cancer? So when was the last time you had any evidence of a disease?
well, I was really confused about that because when in May of 2020, when my MRI showed a bunch of tumors, my surgeon gave me a lumpectomy, which I shouldn't have had actually because it was during the pandemic. So everything just happened really fast because the hospitals were didn't have any patients. And she hadn't talked to my oncologist. So I got a lumpectomy and then I had to get a mastectomy 3 months later
Oh, wow.
because they called me and they were like, why did you get a lumpectomy? Like this, you've already had a recurrence. Like the standard of care is definitely a mastectomy. So I asked my surgeon, I said, well, when am I considered cancer free? Nobody tells you that. Is it when you finish chemo? Is it from your last surgery? Because they're not doing PET scans or full body scans on someone who's not metastatic. So she's like, well, technically, on June 8th of 2020, when I did that lumpectomy, like I got clear margins and there were no cancer cells present. And then when I had the mastectomy 3 months later, in August of that year, they didn't find a single cancer cell.
Oh,
So I consider myself NED in 2020 even though I still did 2 more years of chemotherapy, surgeries, so it's kind of I feel like it's blurry.
yeah. And just for our listeners, NED is no evidence of disease,
Oh,
right?
yeah. Sorry, yeah, no
Yeah.
evidence. Yeah, they don't really use the remission term anymore, at least not in my area in Vermont. They just call it, yeah, no evidence of disease because it's really confusing because people will say, "Oh, I'm in remission," and then 2 months later they have stage 4 cancer, so it's like, "Wait, you know, was I in remission or was it just invisible to tests or whatever?" So I think the language around it is changing. But yeah, so technically, I think I'm at 6 years of being in remission or no evidence of disease, whatever you want to call it,
Wow. Well, great for you. That's
which is
awesome.
great for me. I know I'm one of the lucky ones.
And so do you have to so you don't do any testing or any MRIs or anything to know that
Well,
for
I'm
sure?
supposed to still get the annual MRI on my other breast, which I decided to keep. I didn't the last few years just because it was so expensive on my insurance plan. And since I'm still because the my left breast is just made out of my belly fat because I got a flap surgery. So they don't mammogram that one, but on my other breast, I do get a yearly mammogram and a yearly ultrasound. So my surgeon said, if you don't want to do the MRIs and they're so expensive, you don't have to. And there are often false positives, which actually happened to me as well, which is another story. But I did get a false positive on my right breast and have to get a lumpectomy, which turned out to not show any cancer at all.
Oh,
So
wow.
sometimes MRIs are almost too sensitive, where they'll show some kind of a calcification and then you have to get a biopsy. So again, I'm kind of in a murky area. But
Mhm.
from my understanding, if you're not stage 4 metastatic, you really don't get any full body imaging or testing. It seems like in support groups that I'm in, certain parts of the country or certain parts of the world, people do get approved for PET scans, or they even get approved for this Signatera blood test, which just tests for like circulating tumor cells.
Yeah, that's what I get.
Yeah, I can't get that, at least with my insurance and coverage here, and they don't recommend it. So you just kind of hope you just keep going. And if you get random pains, if they tell me if I start to get splitting headaches, I should get a brain MRI to make sure I don't have mets to the brain. I was having a ton of rib pain for a couple years, and I did get a bone scan to make sure it hadn't spread to my ribs. So it's kind of like you wait till you're symptomatic and then you can get imaging, but otherwise it's not covered.
Wow, that's crazy. So you're just kinda how do you feel about that? Are you living in fear? Like, what's going through your brain on a regular basis? Or are you just kinda real sensitive to what your body feels? Or what does that look like
Yeah,
for you?
I think it varies. I was definitely living in fear for a long time, and I was already so discouraged. Because I felt young and I felt healthy, and I was like, "What the heck? Like, how is this happening to me?"
Yeah.
And I was super fearful. It felt like the wolf at the door. I'm like, when's it going to happen to me? Because I had multiple friends who've died since I got diagnosed of breast cancer, and who thought they were fine, and then boom, it was in their low back. They had low back pain, or they started getting seizures or double vision. And so, yeah, it's terrifying, and it makes you lose a lot of faith in your body, I think, and trust. But I've gotten past that to some extent, where I'm really in a carpe diem, kind of seize the day, just trying to live really intentionally, because I know really at any time it could be me, and I might have less than a year. So I try to always go, okay, if I had a year to live, what would I be doing? How would I spend my time, and with whom? And I just try to really get a lot of pleasure out of life, because it definitely gives you a big wake up call.
Yeah, that's awesome, and you have been seizing the day, man. You've, been on 2 African safaris, right?
Yeah, yeah, I just got back from a long one in April.
Oh
Yeah,
my
I've been
gosh.
traveling a ton, and I am so fortunate to I have part-time work. Because I do massage therapy, so I can work whenever I want. And I've just been like in this mode of buy less, spend less so I can work less, so I can live more. I just my values have completely shifted, and my priorities. So, and
And
I
so were you working during that time during that 3 years when you were going through all of the vasectomy and everything like that?
Yeah, I was, but it was brutal. Like, actually, the first time around, I would probably take a week off after each round of chemo until I started feeling better. So I could do a little massage here and there, but with surgeries and everything, it was never consistent. I was living with my mom, because it's so hard to be an adult and feel like, you can't support yourself all of a sudden. But yeah, I was barely getting by, $2,000 in my checking account for years there. And once I had to have the mastectomy reconstruction, I couldn't really even walk for 8 weeks. So I'm in a dragon boat community here in Vermont, and they supported me big time. They did a GoFundMe and a meal train and a fundraiser, and just totally pulled together for me to help me get by. And I was fortunate. I didn't even have, a family of my own to support, and my healthcare was covered on Medicaid. So it was really just for life, for complementary care, for the basics. But it was tough, but I did massage the whole way through. And I was
Wow.
working at the airport, actually, I was a baggage handler. So, I worked straight through for the airlines. I finally resigned in 20 in tw 4 years ago in 2022 because I was like, "What am I doing this for?" I'm like, "I can't even fly because 'cause I'm getting chemo every 3 weeks." I was like, what am I doing this job for?" But it was fun. But yeah, I worked, but I certainly wasn't growing wealth. It was just like it was scraping by. I was definitely in survival mode.
Yeah. Gosh, giving massages when you feel like shit yourself, man, how could you do that? I used to do massages and I couldn't do that.
It was hard, but it was also a huge source of support. And, massage has always fed me like that. Like, I have so many close connections and it's so rewarding, I think. And a lot of those people just really stood by me, my regulars. So, yeah, it was hard physically and emotionally. I definitely cried through a lot of massages.
Yeah.
And I was in a pretty low point. In retrospect, I maybe shouldn't have been doing massage. Maybe it was kind of using up some precious energy I should have been saving. But yeah, at the same time, it was a lifeline. I was lucky to have work that I could do at my own pace instead of having to, take leave from a corporate job. I hear so many horror stories of people losing jobs or, yeah, not being able to support their families. So
Yeah, that is
again,
definitely.
I was a lucky one there. So to have a family, a mom I could live with who helped support me, and so
Yeah. And you said dragon boat, so tell us about dragon boat.
yeah, so that's I started paddling on a dragon boat team, which here in Vermont we have a big club, and it's kind of a breast cancer sport. It's a lot of people have come together, and it's great exercise, it's competition, it's camaraderie and support. It's a competitive sport done in in long wooden boats. What our club volunteers all over the city too. They go to the Hope Lodge, which is provides housing for cancer patients. They do pretty much any event out there you'll see, Dragonheart Vermont people at. So it's I started doing it even though I didn't feel great and I didn't it was hard. It was really hard to force myself to go to practice sometimes, when I was sick, really sick from treatment. But seeing all these women, a lot of them 60s, 70s, 80s, who were so strong and vital and who had made it through treatment, it just gave me so much hope that
Yeah.
I would make it. So even though it was hard, but it was really fun, and it was fun to be on a team in adulthood. I hadn't done anything like that since high school, basically, like a competitive sport. You go to races all over the country, all over the world. So yeah, so I've been doing kind of dragon boating off and on, I guess since 2019, really since I was first diagnosed.
Wow. And are
And
you really big into the breast cancer community? Like, do you do other things with breast cancer communities?
I I'm in a lot of I was in kind of a young survivor support group. I'm no longer young, although I feel it, but
Mhm.
it was for like 40, 40, 45 and under at that point, and now I'm kind of aged out. I'm in other support groups too, like online. I recently became a mentor, like from through a company that matches people, and then I started becoming kind of like a cold cap consultant at our hospital.
Oh,
So people would say, like from my medical team there, they'd say, "Hey, would you be willing to talk to this person? They just got diagnosed. They're interested in cold capping. I know you know the process. Can you help them?" So sometimes I'll go to someone's house and help them, show them how to put the caps on, and just kind of unofficially done some stuff like that. People are always saying, "You should be a cancer consultant," because I did do a lot of really great complementary care that helped me I did well during
yeah.
treatment. I think did better than some because of all these little things I learned. So, but yeah, no, I wouldn't say I'm like super, super present, but I feel like a lot of people cold call me like, "Hey, I just had a friend diagnosed. Can I connect you to?" And I'm always so happy to talk to people about any questions they have or if they just need to vent about what they're going through because it can be so isolating.
Yeah. And that company that you're a mentor through, would you mind talking about that?
Well, I just started actually, and I just had called the woman. It's called Immerman's Angels, and one of my massage clients told me about it. actually reminds me that I need to check in with her again because we haven't had like a really full conversation because we've been playing phone tag. But she lives in a different state, but they kind of have a pool of patients and mentors and mentees, who just want somebody to talk to who's been through the same form of treatment that they've been. So I was just matched with somebody in the last couple weeks.
Well, that's awesome.
Yeah.
During your travels, did you worry about while you were traveling, did you worry at all about your health and them meeting your health needs should something happen?
Now I haven't thought about it at all. I don't think about that at all. I feel super healthy. When I was in treatment was really a weird time because like 2 years of it were the pandemic. So it was very confusing because I was in chemotherapy, I was masking and there were people who were anti-mask, and who would even shame you or bully you and I think but it was also at the same time more acceptable to travel with masks. And so I was, and I'd always be kind of protecting my own immune system. I lost both my jobs when the pandemic hit with massage and the airport, and I was even delivering groceries for Instacart. And here I was a cancer patient, and I was buying groceries for people who were homebound or who were immune compromised, but I just needed some money, and that's just me. I have no ego about work. I'll do anything. So but yeah, I mean, the last few years, I haven't had to make any accommodations. I haven't even thought about it honestly because it's usually like it wouldn't if say I become metastatic and I start getting symptoms, it wouldn't be like it comes on overnight or, it's like a heart attack or something. So am fortunate to not have to think about it really.
Yeah. Well, that's great. And what's the most aggravating thing you've experienced about living with this disease?
Oh man, there's so many aggravating things. But a lot of it's just because people can't really tell you're suffering. And a lot of it is like I'm kind of a happy-go-lucky person, so everyone's like, "You look great," thinking like, "Oh, cancer treatment must be a walk in the park," and can be really dismissive almost, and kind of like, "Oh, glad that's over," when you finish chemotherapy or when you finish some stage of treatment. I think there's a lot of it is just there's just so much misinformation and so much fear that people say just the most horrendous things. When I was first diagnosed, it was actually all of the kind of quote unquote wellness people in the massage world who were the most harmful and most toxic to me.
Really?
Just so much judgment. I mean, from the start, like I would never do chemotherapy or radiation. Like, how could you expose yourself to that stuff? You're going to die if you do chemo. It'll come back. You're not killing the stem cells. You need to go to Mexico. You need to do IV vitamin C infusions. I mean, not a single how are you in there.
Wow.
Just you should. And like people texting me, oh, well, my hairdresser had breast cancer and she did it, she did the holistic treatment and she cured it, and I'm like, thanks for nothing. Like, I'm literally in chemotherapy right now. Like, how does this help me? Or, I tell someone I'm doing chemo and they're like, oh, have you read Chris Beats Cancer? Or have you considered juicing? And I'm just like, ugh, people are so ignorant and so hurtful.
Yeah.
And a lot of it's patient shaming because it was like, "Oh, well, were you eating dairy? Are you eating sugar? Are you eating milk? Are you eating soy?" And it's like, it's none of your business. And I know that it's because people are scared and they wanna know, "What can I do to keep from getting sick?" But I think there's been this overemphasis on prevention and that you can eat organic and you can do this and you can avoid dyes and that you won't get cancer, and it's just not true. Like, most of us who get it or it's not even something you catch or get. I just call it, I grew a tumor. You don't know why. And it could be chemical exposure or something, but it's just wild the stuff people say to you. And I just got to the point where I'm like, oh, I'll totally try juicing if you want to deliver 5 fresh juices a day to me because it's super expensive and time consuming and I'm sick and I have no energy. And like, it's just, I think that was really, really hard for me. Like, I felt like I was having to have so much grace with people and forgiveness and be patient with them. And they weren't showing me any of that. It was just maybe it was out of concern, but it just felt like judgment.
Yeah. Yeah, that's crazy, especially coming from the, wellness community.
Oh, yeah. I mean, a lot of those people, I never heard a peep from them after they, told me I would never do chemotherapy. You should do this, you should do that. And then never another check in the whole time.
It's like, fuck you. Like, you don't even know. And I mean, and I people say, yeah, like you were talking about, just it's cancer, right? Cancer is just this big thing, like like not every cancer is the same. Some of them are more aggressive than others. And sure, maybe your buddy just got cured by, juicing, or maybe they just stopped doing MRIs and are never really cured, or maybe it was not that big of a deal, but it's like, what
Yeah.
about my cancer particularly?
Right. They usually don't know anything about it. And the Maha movement has made it even worse because there's this whole mentality that the entire medical industry is a big conspiracy. And, they're like, they have the cure for cancer, they're just suppressing it. And I'm like, there's so many different kinds of cancer. There's cancers caused by viruses, there are genetic cancers, more and more they're now linking it with viruses too, which is why they're finding vaccines that are treating pancreatic cancer. So there's all these millions of people who are now anti all vaccines against all scientific research, and they're
Mhm.
being critical of mRNA vaccines. And I'm like, these mRNA vaccines are saving lives. Like, I think there's 6 or 8, trials right now using mRNA vaccines for breast cancer. It's absolutely changing the entire landscape of cancer treatment. And so it's just really hard when people are so black and white, which is just a problem, I think, in our culture anyway. Is I always just want to say to people, like, it's more complicated than that. I'm like, there are a lot of gray areas. Like, you don't really know what you're talking about. But I think that's an aggravating part of it too, is that it's like, here I am, a massage therapist, totally for 20 years in kind of the complementary care world. I used to be like one of these pretty sanctimonious a-holes, like who was like, I eat all organic, I use all natural skincare. Like that was me. I didn't even want to get a mammogram because I knew it exposed you to radiation. And
Huh.
that's so many of my friends now, even after watching what I've been through, they're like, I will not get a mammogram. It'll give me breast cancer. And I'm like, I used to think like you, but I'm telling you, if you catch it early, you have a much better chance of surviving. And, it's just interesting. It shows like we're always learning and we have to grow and we have to change our minds. And I just try to keep thinking, these people just have a lot to learn. They're not trying to be hurtful. But all of that is pretty aggravating. They call them, in some of the groups I'm in, they call them cancer muggles.
Oh, okay.
They were like, "Oh, yeah," when the cancer muggles come up to you and are like, "Are you sure you should do chemo? Like, have you tried lavender essential oil?" You know? It's just kinda maddening. So,
Yeah. What else do you think is important to share with people who are maybe even just, oh gosh, I hate, it's like, if you don't want to get an MRI, okay, but how fast is that tumor going to grow? I mean, you're just your example of how fast your tumors grew, and what your life could look like now that, if you had not done anything or just sat around and, sniffed lavender essential oils, what would you look like today? And you'd probably not even be around,
and so that yeah, and so what's interesting is that so I was 42, and that's not the age where you're even allowed to get mammograms, like, with insurance. Like, at that point, you had to be 45 or even 50, depending on which insurance company you had, because I had no family history. So, I didn't even find mine through mammogram. I just found it feeling my boob, like putting on lotion. I was actually trying to get pregnant at the time. I was doing IVF. So, the whole thing was like, it's so complicated. It was so wrapped up in grief for me with for so many reasons, but I hadn't started the hormones yet for IVF, so it definitely wasn't caused by that. But like you're saying, so as soon as I started researching what triple positive meant and what HER2 positive meant, I realized I had to do chemotherapy. Like, it is such an aggressive type. When they came up with this, when they discovered this drug, trastuzumab, I think it was in the 90s, it was a game changer. Like, if I didn't have trastuzumab, I probably would have been dead within a year. And there's even a DVD, I have it, it's called Living Proof, and it's about the doctor who basically pushed through this drug to go through clinical trials, trastuzumab, which was a game changer for all of us. So I knew right away I had to do it. even though, again, I was very hesitant to do conventional treatment. I was coming from the essential oil world, you know? It was
Mhm.
really hard for me to accept that I had to do chemo and radiation. Like, I was not an easy decision. I was having panic attacks. I was dreading it, you know? So, but to answer your question, I would have been dead for sure if I didn't do treatment. And I still see people in the HER2 positive support groups on Facebook asking, like, I just want to go natural. And everybody's like, don't mess around with this type of breast cancer. But I know that that's people's inclination, is like, how can I support my body to heal itself? You know, that's what we feel intuitively, that cancer should be an anomaly, and, you know, and that we should somehow be able to support our body to fight it. And it just isn't always the case. So that part is really tricky. And then, ironically, I mentioned the lavender, which is funny because now I'm learning that lavender is an endocrine disruptor. And I actually think that I might have gotten cancer, breast cancer, because of lavender, because I was bathed in lavender essential oil, massage oil up to my elbows every day for 12 years or something when I
Wow.
got diagnosed. And now, you know, they're saying like it's really not good to have exposure to a lot of these essential oils, it's particularly lavender. Like, young boys will get exposed to it like in high doses, and they'll develop breasts. And, you know, we don't even know this stuff we're kind of ingesting or putting on our skin and how they're affecting our endocrine system. But so, if anything, that might be what was the tipping point for me.
Yeah.
So I think, like, in talking to people about it, there's none of it's, yeah, black and white or cut and dry. Like, there's so many mysteries. You know, I did the genetic testing. I don't have any mutations that we know about, but my dad died of prostate cancer. So eventually they might find a prostate breast link, you know, and I just decided to not put so much energy into why me and what did I do wrong, because I was like, I didn't do anything wrong. I had been eating organic foods. I had been limiting chemical exposure. I'm like that psycho friend that hasn't drank out of a single use plastic water bottle in 25 years. Like, I am that annoying person. Like, I won't use plastic, you know, and I've been like this. I was like this before I ever got diagnosed. And so when people are out there on their soapboxes telling you what to do to prevent cancer, I'm like, it's not that simple. And so, and I just urge anybody who gets a diagnosis to not go down that path of beating yourself up, of, oh man, it must be because I had a donut, you know? And
Yeah.
it's so much more about living a life of alignment. And I know a lot of people have dramatic life shifts after diagnosis, which I did too, where I was like, man, you know, was I ignoring warning signs? Like, was I getting enough rest? Like, I think I was too much of a workaholic. Like, I always said yes to everything. I didn't have boundaries. You know, I've read so many books since, and one of them that I loved is Dr. Gabor Mate, who writes about trauma and illness. And he wrote it back in 2003, but it's called When the Body Says No. And when I read it, I was like, oh my gosh. I read it probably 3 years ago. And I was like, I have the textbook cancer personality of somebody who's an overgiver, who suppresses emotions, who just never takes care of themselves in a real way. And I thought, if I read this book, I think in when he wrote it, I don't know that I would have gotten cancer. I think I would have lived a different life. But there are plenty of people who do reduce stress, who make big changes, and who do have radical remission. And I think that's wonderful. But at the same time, we can't tell people, well, if you just, you know, got rid of stress, then you would also go into remission, because that's not how it works. So I think the whole thing is just a total mind fuck. You know, what do I do? And there's nobody has the answer. So it can just send your life in so many different directions. And I just encourage people to just try to find peace and grace with themselves and know you're doing the best you can. You know, just take really gentle care of yourself, and whatever that looks like. And, you know, don't listen to the cancer muggles.
Yeah. Speaking of that, ivermectin is one of the big ones. Have you done any research on that one?
No, and I know that, you know, that came out of COVID for sure, and they're definitely doing a lot of studies on it. And anytime, you know, there's studies, I say great, you know, I say go for it. And I think it got so mixed up with, like, the COVID anti-vax, anti-mask movement and like all the craziness that I but was really resistant to it because most of the people who are swearing by ivermectin are also swearing away all conventional treatment. And I'm just much more of a center person I
Mhm.
tried to straddle the line and do both. I don't know enough about ivermectin because I'm kind of past that stage of treatment where I need to worry about it. If my cancer comes back, I'll start looking into it. But like you said, it's very popular in very kind of fringe, like Maha communities.
Yeah.
But
Parasite cleansing, all that stuff.
yeah, and even massage therapists I know I work with now who are super healthy are like, "Oh yeah, I just bought oil of oregano and all this stuff and I'm doing a parasite cleanse." And I'm like, "Why do you even think you have parasites?" Like, I just think in general, wellness has become an illness in our culture. Like everyone is obsessed with supplements and this and red light and gua sha and it just like feels so stressful to me and boring at the same time that I just like, don't even want to talk to people who are like, you know, I don't know, just always trying to find like some optimal level of health. I feel like to some extent we're just supposed to live life. That's part of why I travel. I just want to get away from this country like all the time because everywhere I travel, everyone is so chill and like so much more content and we have so much affluence but we're the sickest people.
Yeah, and you think about, I mean, that stress, that mental well-being is really something, like there's nothing affirmative that says, "Hey, stress causes cancer," right? But we live in a stressful society, like you said, and I've heard it time and time again, and I think the same thing about my life. I live this high stress job, high stress life, and then I kept on doing it to get me through cancer because it made me feel normal, and then I got it right back months later. And you think, what if I wasn't doing that? What if I would have changed my ways? Would that have come back? And you never know, but if you're going to sit there and worry, worry, worry about, hey, maybe I have parasites, maybe I'm going to get cancer, maybe I'm going to do this, maybe, it's like that's not helping this scenario at all.
No, and it's not living. It's all the what ifs. Like I just see it all around me. People track their sleep, their steps. They have to work out every day. They have to have their green powders, their smoothies. Like it's insane. Like what this level of what we think optimal. Everyone wants to be optimally everything. And I'm just reaching a totally different stage where I'm like, I just want peace in my life. I don't want any rigidity. I don't want diets. Like all these people, oh, well, you should be doing intermittent fasting and you should keto. And I'm just like, oh my God. Like, you
Yeah.
can find articles to support anything out there that you want to believe. All of them contradict each other completely. you know,
Yeah.
Keto is the polar opposite of juicing, which is all sugar. So it's like, it's so interesting. But I think that's just where I am. And to me, it's a sweet spot of just like intuitive eating, intuitive exercise. Like I don't push myself anymore. I'm like, why was I so obsessed with doing HIIT 3 days a week and da 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 da? And how can I be the most everything? Now I'm like, I eat what I want when I want. I try to eat beautiful, colorful food, and it does make me feel good to eat that way. But I also will eat a hot dog at a baseball game. Like I don't know. I'm just in a stage of no rules, sort of. I want to enjoy my life.
Hot dog, how dare you?
But
Oh my
there are
God.
people who would say that, and they're like, "Oh,
Yeah.
you're gonna get cancer from the nitrates," and
Yeah.
yeah, it's a lot. Like our whole culture is a lot. Everyone's obsessed with longevity and youth, and once you get a diagnosis that's potentially terminal, and I don't know if you've had this feeling, but it just shifts that whole perspective where it's like, I don't know what it even means to age.
Yeah.
Precious this life is, and how much of it we miss because we're just hustling.
Yeah, and it's the little things that I mean, that's what bugs me now is, like, the little things that people get so aggravated with, and I'm just like, "What the fuck? Why? Why are you so aggravated with that?" Like, it's life is so much more than that little thing, and that little bit of stress is not helping the scenario at all.
Yeah, the road rage I see in people. Yeah, I know. I saw a book called like "Don't Sweat the Small Stuff," and it's all small stuff because it really is like people focus on the negative, and you're missing everything, even just out your window with the birds and wildlife and sunsets and like the splendor of this world. And that's just what I'm trying to enjoy is like slow down more, be more present. And that's what safari is. That's why I love these trips to Africa because you just get to sit there and look at wildlife all day and you're sleeping in tents. You're so connected with nature and you're not on your phone. You're not worried about the news. It's like our world is just bombards us with stuff to care about. And I get so tired of it. I'm like, it's not supposed to be this hard.
Yeah, it's exhausting.
It's exhausting. And so, yeah, and I'm trying to take those lessons from safari here. I've been like trying to go to a new nature preserve every week and just enjoy where I live, and bring my binoculars and look at the birds. And I don't know, it's just so nice for each day to feel full instead of just a never ending to do list. And so that's kind of where I've come to in the whole thing is that I just like each day I want to be like, okay, if today was the last day, it was an awesome day.
Yeah, that's awesome. I love that.
Had this great breakfast. I had an amazing cup of coffee. Like everything is pleasurable, if you think about it, like the stuff we get to do that the rest of the world would give anything to do. Even the stuff we're annoyed about of being in traffic, like most people don't have cars, like where
Yeah.
they can just go anywhere they want. We complain about gas prices. We complain about airfares when we can fly anywhere in the world, and most people will never leave the country they grew up in. They don't even have electricity. So
Yeah.
it's all perspective, and I think all of life is like that. And cancer's just given me such a better perspective, and I feel like my life is sweeter now than it would have been if I hadn't been diagnosed, which is crazy. Is I don't wish that I don't wish that I'd been through all this necessarily, but at the same time, I can be really grateful for the place it's brought me.
That's awesome. That's great. I love to hear that. Well, it's been a pleasure talking to you. And I always ask my guests, do you have any random jokes that you want to tell?
I don't. I'm terrible at remembering jokes. And all the jokes that I know are like for my nephews who are 6 and 3, and so they're really silly. But I was actually like laughing and just looking at funny cancer memes today, and one of them was a list of like different cancer bands like that people have started in oncologists called like the free radicals or the remissions. And I was just kind of laughing like I just love how people can make a lot of humor out of out of these situations, like Tig Notaro doing stand-up comedy after, she or they got breast cancer and stuff. So I don't have a specific joke, but I think it's just really it's always good to laugh at the absurdities of life.
Yeah, did you ever see that? She did a one show that was she was topless. Did you see that?
I did like when I first got diagnosed, I think she and I were kind of on the same trajectory, but I remember watching it like on Netflix and it just blew my mind. And I actually wasn't really into comedy then. And now I'm like a Patreon at our comedy club. I go to stand up comedy almost every weekend
Oh, really?
and find so much joy in it. And there's actually been quite a few comedians who have gotten up there and told their cancer stories, particularly breast cancer, and learn to find the humor in it. But it's so good to hear people talk about their stories, and it makes us all feel connected. But yeah, that was powerful when Tig took her shirt off. So it's not something we're used to seeing. It's like the marathon runner who runs, after having a mastectomy with no reconstruction. Have you seen
I
her?
have
It
not.
did the
Uh-uh.
London Marathon. Yeah, she like runs the marathon topless.
Oh, wow.
But yeah, it's really inspiring because it obviously impacts millions of women, and no one ever used and men. And I feel like the men get left out, but no one ever used to talk about it. It was like hush hush. Oh, I had a surgery. Nobody says why, and now it's
Yeah.
different.
Yeah, that's just weird. I've had people come up to me and like, oh, like in a secret, like, oh, I had breast cancer too. It's like, why is this a secret? Like there's so many of us who've had breast cancer. Why is that a secret? And I have seen on TikTok, I've seen several people started doing dances with their tops off lately.
Yeah, one of my friends here started a group called Fiercely Flat for people who choose not to do reconstruction because it's a really hard decision for a lot of people.
Yeah.
And it's, with the way we define femininity and everything. So, yeah, I mean, I think it's great. The more people talk about it and share, and obviously prevention's important, but so is treatment. and fundraising, and just that, we're all in it together. Everybody's going to get something or suffer from something. And the best things we can do is not judge each other and just support each other.
Yeah, I did have a question about your deep flap because I had the deep flap too. And when when I got it, she said, "Well, you're gonna have to go through a second surgery to do, like, the cosmetic part of it." Did you have to go through a second surgery, or did you just do one time and done?
I didn't have to, but I chose to, and then I deeply regretted it because the way the way my surgery place did the deep flap, so deep, I don't know if you've talked about it before, but it's the deep inferior epigastric perforator. It's the name of the artery that's in your belly. It's not like deep ocean.
Yeah.
But my place, like, they ended my incision on a place in the hip where it kinda gave me, like, these love handles. It's not what they call dog ears, where the scar, like, kind of pinches out, but it gave me, like, this SpongeBob SquarePants shape, so I was super square, like, through my hips, like, my stomach was flat, but it just made me, like, really a weird shape. So they had told me that in the second surgery, which they call a revision, that they would, like, take that fat, kind of, like, narrow my hips down and then add it to the breast
Mhm.
because mine were really funky looking because I had one healthy breast and then one reconstructed, and I didn't have enough tissue, and my veins failed, which is why the surgery took so long. So they had, like, pinned it up really high in my chest. So they weren't symmetrical. They weren't the same shape. I'd had radiation. So the second stage, they were going to add more fat to the reconstructed breast to try to make them look more symmetrical. But it was just it was super painful. I wish I hadn't done it because while I was under, I guess they realized that there wasn't enough fat on my hips, so they decided to do lipo on my thighs, which we had not discussed, and it was so painful. I mean, I had bruising down to my knees and I'm all lumpy because it's not done in, like, a cosmetic way, or I don't know how to explain it, but it's like they jam these metal rods in and just kinda, like, move it back and forth until they loosen up the fat, so it's incredibly painful.
Ooh.
This When I woke up, the doctor was like, because we had to drive back from Boston, and he gave my mom the prescription. He's like, "Yeah, we were gonna just have you pick up some, like, oxys in Vermont, but she's definitely gonna need them for the drive home, like, you need to fill it now." And I didn't think it changed my outcome at all. It was just another surgery I had to withstand, and then I didn't realize there would be floating, like, globules of fat from it because they just inject them. So I was finding lumps in my armpit, like, right along my lymph node incision that I thought might be tumors, and I was terrified. So I had to go in, and my surgeon, would extract it, and she's like, "Oh, it's just fat." But, it's just that's not something anyone had warned me about. So, like, there's plenty of people who do 2, 3 surgeries with the deep flap and do lots of revisions because they really want this, like, great outcome. And some people's bodies, they do if they have a little bit more fat. Like, he admitted to me the year after, he's like, "Well, you weren't really a great candidate for the deep flap. You didn't really have enough tissue to
Yeah.
make a great breast." And I was like, "Well, that would have been nice to know. Maybe I would have tried an implant first or something." I didn't want an implant, but yeah, that was a whole different stage that was really stressful. But I think it's really personal whether you wanna do revisions. Some people do get the nipple constructed in their second or third revision where they, like, pinch the skin together to make, like, a bump.
Yeah.
So if you didn't I don't know if you did nipple sparing or not, but I didn't, so I didn't have a nipple.
Well, yeah, I did nipple sparing originally, and then when I went to get my deep flap and just for the audience, deep flap is really like so they cut out a lower part of your belly, and they take that fat, and then they move it into your breast to make a new breast. So you have a scar on your belly, and then you have scars around your around your breast, but yeah, so I did that, and she was like, "Well, I don't think they'll sit right if we keep your nipples." I'm like, "Really? I kept my nipples for what?" You know? And so then she took my nipples off and I don't know, mine look horrible and my belly is horrible as well. It's deformed. My belly button's like in the wrong place and it's just yeah, they're no bueno. And they're not even like big enough. I wish I would have just stayed flat. And then I can't go through the revision because my body's just not strong enough, to go through another surgery like that. So,
I know, and a lot of people have that, and I'm sorry that happened to you because my stomach just would not close. It was so tight, and I have a huge scar, and I think people
me
who
too.
heavier to start and who have like a panis, of like a lower belly hanging, they really love their outcomes because they end up with like kind of a snatched waist and then like really big breasts. But yeah, I was just trying to get like a semi similar breast to my other one, and I still didn't have enough tissue. And it was just so much to go through. But I think maybe like you, I felt rushed sort of to make the decision. And I wasn't ready to wrap my head around being flat at that point, especially because for me, I would have one flat and one breast because I wasn't doing bilateral. So it's really unique for everyone. But if I could go back in time, I definitely would not have done the deep flap. Like I've had way too many side effects from it and cording and numbness. And like you said, my belly button is just like feels in the wrong spot. And I just feel totally disembodied. And I hadn't realized that like mine's like a 16-inch scar. Like it cuts all your lymph channels. So it's really easy to get a lot of swelling in your belly and like just all kinds of stuff. Like they didn't really prepare me on how dramatic a surgery it would be. And for some people, I think they really like the outcome of just having squishy breasts, even if the breasts don't have much sensation. But like you, I think if I could go back, I would have just not done the deep flap. I think it was way too like extreme a surgery. And I don't like mine looks pretty good now, but it's really hard. There's so many people like you who aren't happy with the results, even after going through all that trauma.
Yeah. Yeah. And I think too, like, I wanted it because I don't know, you just think like, oh, I'm going to feel more like myself, with breasts. And now I'm just like, oh my God, I'm uncomfortable. I have like no feeling in my chest, but do have discomfort, it's just, and then I'm just uncomfortable with the way I look, and it's just a hot mess. So yeah, hopefully people who are listening will really consider it. And I even waited yeah, I had to wait a year after radiation before I got mine. So I didn't feel rushed, but I mean, the lady just really sold me on it. The surgeon just really sold me. And I was like, oh, I don't want to get the lats because, it's going to impact my paddling and blah, blah, blah. And, I don't know. Like in hindsight, I was just like, God, I felt good when I was bald. I felt good when I was flat. I got used to that looking like that.
I
Such a,
know. Yeah, I know. They talked me into it too. They're like, you're young and you're going to want to be symmetrical. I talked to a lot of women who'd had every kind of surgery too. Because of Dragon Boat, like almost everybody on my team, had had a surgery of some sort. And so I talked to people about implants versus, going flat versus one or the other. And it was a really hard decision. But yeah, I don't think I would do it again. So, but you can't judge yourself again. It's like you did what you could in the moment, whatever felt right, and that's all you can do.
yep, exactly. And here we are with our new normal lives. And Abby is just living it and making the best of it. So I really appreciate hearing that.
Yeah, thanks, Tammy.
Well, it was great talking to you, and you take care.
All right, you too.
Okay, thanks.
Yep. Bye-bye.
Bye. If you like this episode, please follow me and leave some comments for us. Thank you.